Hello and welcome to IPC TOUCHPOINTS, our expert insights series. Today we are going to be talking about IPC investment priorities and how post-acute facilities can break the chain of infection. I'm your host Abhi Zadav, Director of Healthcare Insights at Georgia Pacific. We are joined here today by Missy Travis, seasoned infection preventionist and founder of IPNC Consulting. So many post-acute facilities have been feeling the impact of the pandemic, and by post-acute facilities, I mean skilled nursing homes, independent and assisted living facilities, inpatient rehab facilities. Can I ask you to reflect on the current challenges that these facilities are facing and the constraints they have to deal with in day-to-day decision-making?
Yes, so one of the biggest issues is staffing. One is the rapid turnover of staff, which then leads to not having enough staff. And in particular, I see a lot of turnover in the infection prevention role and the nursing leadership role. And those two roles are very important in terms of the infection prevention program. We also know that, when you have staff turnover, that can be very expensive because you have to bring on new staff, retrain them. And so that takes away resources that might otherwise be used for quality products for infection prevention. And so that can be another issue, is just the lack of resources. And finally, I think just a lack of general understanding about infection prevention. Oftentimes I see in long-term care facilities that they're very focused on the regulations. And the regulations were put in place to support the infection prevention program. So I think if you have a good understanding of infection prevention, oftentimes you're going to meet the regulations. But many times it's switched where they're focusing more on the actual regulation than actually what the regulation was created for, which is for those infection prevention principles.
So you touched upon quite a few important topics with staffing challenges, lack of resources, the ever-evolving regulatory landscape. Anyone involved in this field of infection prevention and control really internalizes this concept of breaking the chain of infection. Tell us why this construct is so important in considering products that a post-acute care facility may commit to.
Yes, so when I'm thinking about the chain of infection, we have our susceptible host, which is our resident, and then we have the germ that we're trying to prevent from ever getting to our resident. And there's multiple modes of transmission and ways that they could get there. The role I see for products is oftentimes they're going to be the tool that we're going to use to break that chain in the mode of transmission. So if you look at hand hygiene, for example, if I have a germ on my hands and I clean my hands before I go into the room to take care of the resident, I've then broken that chain of infection by using those hand hygiene products. Another example is cleaning and disinfection. If I have germs on a surface or on some resident care equipment, I can clean it using a disinfectant, and then I've gotten rid of that germ. It never makes it to that susceptible host. And that's what our goal is in infection prevention. We want to prevent it from ever happening.
So those are some great examples, the disinfecting products, the hand hygiene products. Can you share with us another example?
Yes, so I think, staying, on the hand hygiene example and looking at something like, say, paper towels. When I'm going to clean my hands, if I don't have paper towels readily available that I can access easily, if I don't have paper towels that come out, in a big enough square so that I can adequately dry my hands, if they're not easy to pull out or too much comes out, there's lots of different things and nuances that go into these products used by healthcare workers. But my point is if you don't make it easy for them, oftentimes they're not going to do it. They're going to avoid that just because they don't like that product or they feel like it's not easy to use. And that's what's going to impact my hand hygiene compliance, which is then going to impact the infection prevention program. So I guess what I'm trying to say is just make it as easy as possible when it comes to products. Get products that people like and that they're easy for them to use.
So let's transition from products to usage areas like resident rooms, nursing stations, public restrooms. Does the chain of infection model apply more broadly in decision making in those areas?
Yes, I think it can apply across multiple settings because germs live everywhere. I also think it's about establishing consistency, and whenever you have the same products in multiple areas, it's very consistent, and so people know what to expect. They're getting the same quality regardless of, where they're interacting with those infection prevention products. While communities may be different, the infection prevention principles are the same no matter where you are, and we have the same primary goal to stop the spread of germs. And I think if everyone understands the chain of infection and what their role is in the chain of infection and what the role of products is in the chain of infection, then we're going to have a more successful infection prevention program.
I really like the way you expressed how consistency is key, whether it's in disinfection products or hand hygiene products. And there are so many things that a facility can do. What do you think are the most valuable investments a facility can make in promoting that culture of infection prevention and breaking the chain of infection?
Yes, I think that's a great question. And so, I like to think about the 3 Ps. You've got people, products, and partners. And so for people, this is going to be your most valuable investment. You need to have that trained infection preventionist, and also you have to have trained clinicians that they know the infection prevention policies and procedures and they are following them. For products are they're created as tools for us to use. As I said earlier, they can help stop the chain of infection and they can be valuable tools. That being said, the people have to use them correctly and they have to be the right products. And so we want quality products in place that healthcare workers are actually going to use. And then finally, when we think about partners, we need to work together. Infection prevention is not a solo act. I cannot do it by myself. In most instances, I'm not doing a lot of the care for the resident. It's going to be the healthcare worker. It's going to be the person working in housekeeping or environmental services. And so those are my partners, and I have to do my part to educate them and support them, and so that they are carrying out the infection prevention policies and procedures.
That's a great way to think about it. The 3 Ps, the people, products, and partners. And a lot of infection preventionists are doing great things in post-acute settings. How can they communicate some of these initiatives to the loved ones and families of the residents to attract new patients and new residents?
That's a really important point. In all healthcare settings, I think safety is the one quality that most family members are looking for. And if you think about it yourself, if you had a family member who was entering the post-acute care setting and you came to me and asked me about facilities, and I told you there's a great facility, they have state-of-the-art equipment, they're fully staffed, it's a beautiful new building, but I'm not really sure how safe it is. Maybe there's a lot of infections, there's a lot of med errors. That's what's going to capture your attention, and you're not going to want your loved one to go there. And so we need to focus more on communicating that to the family members, that we have put all of these different measures in place to make this a safer place for your loved one to be. We have all of these hand hygiene dispensers. We have a hand hygiene program. We have tissues out here in the waiting room so that people are not coughing into the air and potentially exposing our residents. And just being transparent about all the things that you are doing so that they know, because sometimes that work is invisible and they don't see what all that you are doing in the background. The other issue is, some of these older facilities aesthetically don't look as well just because they're older, and maybe they don't have the resources to update. And so even more for those facilities, I think, to communicate all the things that they are doing to keep that environment clean and to provide those extra tools and extra products to promote safety and promote infection prevention.
I want to thank you, Missy, for sharing your valuable insights and meeting us here at Georgia Pacific. As we like to say, healthcare experts meet hygiene experts, and we value experts like you who are sharing your insights with the healthcare community.
Thank you for including me in this valuable discussion.
And folks, I hope you'll join us for additional installments of IPC Touchpoints.